My favorite part about being a physical therapist is definitely interacting with the patients. We're impacting them on things they're doing on a daily basis. And you see the progress in them, and it's really cool to see how from day one they might not be able to stand up, and then you can work with them to actually get them walking and going up and down the stairs and returning to normal life.
I have been an employee of Henry Ford Health System for just over 17 years. Guillain-Barré is a very rare neurological disease where it attacks your limbs. I was paralyzed from my neck down.
He worked with us 3 hours a day between physical therapy and occupational therapy. It was probably one of the most exciting times in my career. I was like a proud parent, it felt like, just to see him make that amount of progress in that amount of time. It's not something you see every day for somebody to go from that low level to walking on their own. So it was a very proud moment.
Initially, I kind of thought, 3 hours a day, both physical therapy and occupational therapy would be no issue at all. And I mean, every day I just would be whipped. And that went on for 5 weeks, 6 days a week. But when it was all said and done, when the day actually came to be released, I felt like I was somehow losing something. This had become home for me.
It is a true privilege to be able to make a difference in the life of a patient every day. Hoppenworth, she came to me with Legionnaire's pneumonia.
I was rushed to the hospital with only a 10% chance to live and woke up 2 weeks later after coming out of a coma. I was then transferred to Wyandotte Hospital Inpatient Rehab, where they started to do my therapy and teach me how to do everything all over again. One day, one of my therapists said, "Wheel her up to the parallel bar." And she says, "We're going to stand you up." She counted to 3 and she pulled, and I tried and I didn't make it. So she counted to 3 again and she got me up on my feet, and I was shaking visibly. And at that moment I knew that I would be able to walk again. And I fell apart, just like I am now. It was a very emotional moment, because I knew that they were right, I would be okay.
She was very debilitated, extremely weak. She wasn't even able to sit in her bed. She wasn't able to feed herself, to dress herself, bathe, stand, nor walk. And after nearly a month in our unit, she actually walked out of our facility. It's a joy that's undescribable. I mean, that is honestly what made me choose this field. There's some fields where you just diagnose, you can do a lot of preventative medicine, you can give a medication to help hopefully prevent something from happening again, but when what you do actually changes the outcome, improves their mobility, their function, their quality of life, there's nothing I could imagine doing other than physiatry.